Hi, and welcome to the July 25th, 2012 Plastic and Reconstructive Surgery Journal Club. My name's Damien Marici, I'm a plastic and reconstructive surgeon, and this is Dr. Shane O'Neill, who has recently passed his exam and will be a consultant plastic surgeon in a matter of months. So Shane, we did 4 papers today.
4 papers today.
The first paper was the tip rhinoplasty on broad noses in the Turkish population, Eurasian noses, from Erol in Turkey. What did people think of this paper?
I think this was really credited as being an enormous case series of 3,800 patients which comprise only 58% of this author's work, which is just a phenomenal caseload. So we really respected the lifespan of work that it was represented here, and we see again the use of this Turkish delight technique for refining the nasal tip. So there are a number of other mechanisms of refinement for these very difficult, boxy, ill-defined tips in this ethnic subset.
Yes. I guess there are a couple of things that people spoke about with the discussion. One was the fact that it was a closed approach, whereas certainly those who attend the Dallas rhinoplasty course and a lot of other experienced rhinoplasty surgeons like Giebisch from Austria advocate an open rhinoplasty to get a better view, especially when you're doing tip work, whereas obviously Dr. Erol is getting unbelievable results with a closed approach. Also, the defatting of the soft tissues is something that some rhinoplasty surgeons have concerns about, which can give unpredictable results. And
I guess his way around that was to use the Turkish delight to shield those irregularities after the defatting process. He found though that he was getting quite a lot of tip fibrosis, and so to address that he was using his post-operative steroid protocol to help to minimise that problem.
In terms of the paper itself, it was noted that although there was up to 10 years of follow-up, or even longer for some patients, that there weren't many representative photos. There were only a relatively small number of cases selected for photographic representation, and also patient satisfaction and results weren't necessarily presented with a validated assessment
survey tool. That's right. That's right.
All right, okay, that was the first one. The second paper we looked at was the prosthesis salvage in breast reconstruction, patients with periprosthetic infection and exposure, by Prince et al. From Tampa, Florida. Now, what did people think about this paper?
Well, people thought that this was a very important topic to address again. It's something that's come up now repeatedly in recent literature as a new paradigm in the capacity for a salvage rate to exist at all over the last few years in these periprosthetic infections. So the fact that this group is achieving a 3/4 so-called salvage rate is just phenomenal, and is a real psychological advantage for patients, particularly in the reconstructive but also in the cosmetic setting in periprosthetic exposure and infections. So this offers patients an ongoing reconstruction, ongoing prosthetic reconstruction, which is a huge advantage, as I say, for this group.
Yeah, the key parts of their surgical technique, which is aggressive debridement, putting in, followed by pulse lavage with antibiotic, and also putting in a new tissue expander or a new prosthesis. And it was discussed in the group whether this would be covered by insurance. And it was agreed it would be covered by insurance if a new tissue expander did need to go in, followed by insertion of a size 15 Blake drain. And
this technique also is in favour of the biofilm theory by eliminating the biofilm contaminated prosthesis, replacing it with a fresh tissue expander or prosthesis, and also that lavage, that antimicrobial laden lavage process is also a biofilm clearing technique.
Pointed out that this is a common exam question for those of you coming up for the fellowship exam. One thing that wasn't presented in the paper that some people would have liked to have heard about was there was no data presented on how many of these patients had had a latissimus dorsi flap covering their expander or implant, as opposed to those who had just had a tissue expander put submuscular or partially submuscular.
And interestingly, the staph epidermidis is implicated again strongly, as it has been now in several biofilm papers. So we're seeing that again in 25% of these situations in this particular paper.
Okay, the last 2 papers were both dealing with the issue of platismoplasty and aesthetic recontouring of the neck. The first one was the updating the concept on neck lift and lower third of the face by Cardoso de Castro of Brazil from the July PRS 2012. And then the other one was a classic paper on corset platysmoplasty by Feldman from the 1990 PRS. So what did people think about these papers?
Again, so starting with the more recent paper, the Brazilian paper, this is an enormous case series and valuable collection of the experience of this group of 3 or more surgeons and 1,500 cases. And they describe a safe and reproducible technique which avoids any submandibular gland procedure and also avoids any digastric muscle procedure. So they advocate a safe, reproducible technique. The trouble with it, to some extent, is the lack of objective outcome measurement tools again here. So we have this descriptive surgical technique and some fantastic photographic results, but the patient satisfaction or outcome measures are a little bit lacking there in terms of their objectification.
Also, it was pointed out that the reported incidence of complication in their series was far less than complications reported in other series. And we wondered whether that was due to technique or follow-up issues, but it was certainly a surprisingly low incidence of complications.
And they also advocate a safe and judicious fat resection technique using a controlled scissor technique, which is valuable for avoiding contour irregularities.
Yeah. On the same topic, the classic paper was a corset platysmoplasty paper by Feldman and al. This is a technique which is used by many plastic surgeons around the world. This paper was a very good description. Feldman does multiple layers, and not just in the midline. He also plicates over the submandibular gland and elsewhere along the platysma. His results were subjective, but he certainly had a good description of the technique, and his pre- and post-operative photos were very impressive.
That's right. I think this is a very tailorable technique in that the longitudinal running sutures can be redone in multiple directions up and down to titrate the amount of tension to the need of the individual, and that can be supplemented by that paramedian and more submandibular gland level plication as well, so that you can get a multi-level and very tailored and tight reconstruction.
Okay, well that's it for this month's Journal Club. For those of you who are there, I hope you enjoyed it, and for those of you watching now, thank you for listening.
Good night.